Oops, I need to do a view of the room. So this is the room. Here are my tools, my patient. There's nothing out here. Okay. All right. Hi, my name is SLeMay. I'm a PA student at Nova Southeastern University, and I'm going to be performing a neurological and musculoskeletal exam today. Okay?
Good.
I'm going to wash my hands. The patient appears to be healthy and in no apparent distress. I'm going to start by asking some questions. What is your name?
Mary Welch.
And where are we?
We're in Winter Garden, Florida.
Great. And what day of the week is it?
This is Saturday.
The patient is alert and oriented ×3, and she is dressed appropriately, has appropriate behavior, and appropriate speech. For long-term memory, please tell me the last 3 presidents.
That would be President Trump, President Obama, and President Bush.
Perfect. And for short-term memory, remember the words house, cat, and dog, and I'll ask you them in a few minutes, okay?
Okay.
And for intellectual ability, count backwards from 100 by 7s.
100, 93, 86.
Perfect. We're going to move on to the cranial nerves. Close your eyes and cover one nostril. Smell for me. What do you smell?
Floral.
Perfect. And then switch nostrils. What do you smell?
Citrus.
Perfect. Cranial nerve 1 is intact. Cranial nerve 2, I'll test with the Rosenbaum chart. Cover your left eye, and with your right eye, read the smallest line that you can read.
Okay, that would be 63925.
Perfect. And then switch eyes.
63925.
And then with both eyes.
The same, 63925.
Perfect. OD, OS, and OU are 20/50, and cranial nerve 2 is intact. Now I'm going to check cranial nerve 3. Follow this with your eyes and keep your face towards me. Perfect. Cranial nerve 3, 4, and 6 are intact. There is no nystagmus or lid lag. And for cranial nerve 5, the sensory portion I will do during the dermatome examination, and then the motor portion right now. Clench your jaw, and then again. Great. Cranial nerve 5 is intact. Cranial nerve 6, I tested with the EOMs. Cranial nerve 7, raise your eyebrows. Close your eyes, don't let me open them. Perfect. Smile, frown, show me your teeth. Puff out your cheeks. Great. Cranial nerve 7 is intact. Cranial nerve 8, I'll have you close your eyes. What do you hear?
1, 2, 3.
Great. And again.
4, 5, 6.
Cranial nerve 8 is intact. Cranial nerve 9 and 10, I would check with a gag reflex. I'm going to check cranial nerve 10 by saying ah.
Ah.
Great. The uvula rises midline. There is no deviation with phonation, and cranial nerve 10 is intact. Cranial nerve 11, shrug your shoulders. Look to this way. There you go. Perfect. And then this way. Great. Cranial nerve 11 is intact. And then cranial nerve 12, stick your tongue out for me and move it side to side. Cranial nerve 12 is intact. What were those 3 words I asked you to remember?
House, cat, and dog.
Great. Now we're going to move on to the dermatome, so go ahead and lie down for me. I'm going to move my camera so you can see where I'm using a dull and a sharp stimulus here. Okay. Tell me if you feel, close your eyes for me. Tell me if you feel a dull or a sharp stimulus. C4?
Sharp.
Good.
Sharp.
C4?
Sharp.
C5?
Sharp.
C5?
Sharp.
C6?
Sharp.
C6?
Sharp.
C6?
Sharp.
C6?
Sharp.
C7?
Sharp.
C7?
Sharp.
C8?
Sharp.
C8?
Sharp.
T1?
Sharp.
T1?
Sharp.
And then I would do T4 here and T10 over the umbilical region. Normally my patient would not be wearing a shirt. Now I'm checking for L3.
Sharp.
L3.
Sharp.
Is it sharp or dull?
Oh wait, I'm sorry. That's dull.
L3, and then now?
That's sharp.
Good. L3 again. How about now? L4?
That's dull.
Good. L4?
Sharp.
L4?
Dull.
L4,
sharp,
L5,
sharp,
L5,
sharp,
S1,
sharp,
S1,
sharp,
and then on the feet, L5,
sharp,
L5,
sharp,
S1,
sharp,
or excuse me, L4,
sharp,
and then L4,
sharp,
S1,
sharp,
and S1.
sharp,
Okay, so the patient is receptive to sharp and dull stimulus. Now I'm going to go through again with the soft stimulus. We're going to start with the cranial nerve 5 of the face. Tell me when you can feel this.
yes,
Good. The ophthalmic,
yes,
the maxillary,
yes,
maxillary,
yes,
mandibular,
yes,
mandibular,
yes,
and we're going to go to C4,
yes,
C4,
yes,
C5,
yes,
C5,
yes,
C6,
yes,
C6,
yes,
C6,
yes,
C6,
yes,
C7,
yes,
C7,
yes,
C8,
yes,
C8,
yes,
T1,
yes,
T1,
yes,
and we do T4 and T10, L3,
yes,
L3,
yes,
L4,
yes,
L4,
yes,
L5,
yes,
L5,
yes,
S1,
yes,
S1,
yes,
L5,
yes,
L5,
yes,
L4,
yes,
L4,
yes,
S1,
yes,
S1.
yes,
Great. The patient is receptive to all of the soft stimulus, and cranial nerve 5 in the face is intact. Now I'm going to check the vibratory sense. Close your eyes for me. What do you feel?
vibration,
Good. How about now?
and yes, vibration,
Great. Okay. How about now? What do you feel?
yes, vibration,
Good. And again?
yes,
Great. So she is reactive to the vibrations. And how about we're going to move on to the proprioceptions.
excuse me,
Are you okay?
mm-hmm.
Okay. Is your thumb extended or bent?
Extended,
Good. How about now?
I'm sorry, it's bent,
This one's bent. Yeah.
That's bent.
You had it right.
Yeah.
Is your toe extended or bent?
extended,
Okay. And now?
bent,
Perfect. And so she is able to recognize the proprioception there. So we're going to move on to the stereognosis. So tell me what this object is with your eyes closed.
tablespoon,
Great. So she is able to recognize the object with stereognosis. Now we're going to sit up and move on to the upper extremity portion of the exam. Okay. I'm going to start by inspecting. I'm inspecting the shoulders, elbows, wrists, and fingers. I am looking for any falsifications, atrophy, tremors, discolorations, deformities, or swelling. These are not noted, and the arms are symmetrical and aligned. Now I'm going to palpate. I'm palpating the SC joints, the clavicles, the AC joints, the scapula, the deltoids, the bicipital groove, the triceps, the biceps, the olecranon processes, the medial and lateral epicondyles, the extensors of the forearm, the flexors of the forearm, the carpals of the wrists, the metacarpals of the hands, the PIP joints, the MIP joints, the hypothalmar and the thalmar of the palm. Great. There is no bogginess, heat, tenderness, or swelling over the bony prominences and the joints of the arms, and the muscles are symmetrical without spasms. We're going to move into the range of motion, so we're going to start with the shoulders. Go ahead and extend your shoulders up like this. Good. Flex your shoulder, or your, shoulder bones, very good. And adduct, abduct, and internally rotate. Externally rotate. The shoulders are within full range of motion, and the elbows now, we're going to flex, extend. We're going to supinate, so here, pronate, and back to supinate. Great. The elbows are within full range of motion, and then your wrists, we're going to go like this, extension, flexing of the wrists with your hands up. We're going to radially deviate out and ulnar deviation in. Great, and then with your fingers we're going to spread, so abduct your fingers, adduct them together, perfect. Flexion of the hand. We're going to flex our thumbs, extend our thumbs, adduct our thumbs like this, abduct, and then fingers to all thumbs, perfect. So the shoulders, elbows, wrists, and fingers are all within full range of motion. Now we're going to move on to the manual muscle exam. I'm going to start by having you put your arms out straight like this. Don't let me push them down. So this would be extension. Don't let me pull them up. Flexion, and out to the side like this. And you're going to try to do this, okay? Push them out. That would be abduction and in, adduction, and now up like this, and you're going to try to rotate them down, okay? Push down. Good, and then back. That would be externally rotating. This way would be internally rotating. And then the elbows, so you're going to flex up like this. Good, and back down. Great. And then pronation, so you're going to twist your wrist down. Good, and then the other way, supination. Same thing with this side, so pronation and supination. Excellent. And then the hands, the wrists, so you're going to try to move your arms back like that, your wrists back, perfect, and then back down. Great, so that would be flexion, and then up would have been extension. And now spread your fingers. Don't let me push them together, okay? So this would be checking abduction. Don't let me push them apart. This is adduction. Now grab my fingers with your hands. Great grip. So this is flexion of the finger joints. And then hold your hands like this. Don't let me pull them apart. Great. So the manual muscle strength is 5/5. Now we're going to move on to the lower extremities. So go ahead and lie down for me over here.
Okay. Backwards or forward?
On your back.
Okay.
Perfect. I'm going to start by inspecting. I'm looking at the hips, the knees, the ankles, and the feet. I am looking for any calcifications, atrophy, tremors, any discolorations, deformities, or swelling. None of these are noted, and the legs are aligned and symmetrical. Now I'm going to palpate. I'm starting with the iliac crests, going to the greater tuberosity of the femur, the vastus lateralis, the vastus medialis, the rectus femoris, the suprapatellar pouches, the epicondyles of the femur, the tibial plateaus, the patellar tendon, the tibial tuberosities, the popliteal fossas, the gastrocnemius muscles in the back, the tibialis anterior, the Achilles tendon, the medial and lateral malleoluses, the MTP joints, and the IP joints. There is no swelling, there's no bogginess, heat, or tenderness over the bony prominences or joints, and the muscles are symmetrical, and there is no spasms here. There are no nodules in the popliteal fossa or popliteal cysts there. Now we're going to move on to range of motion. So I have you move your knee up to your chest. Excellent. And now I'm doing internal, external rotation. This was flexion of her knee up here. And then this one, so flexion, internal, external rotation. Excellent. And now try to kick me with this in the leg right here with your leg. Great. This is abduction and cross it over. Adduction. Great. And then same thing on this side. So try to kick my hand out to the side. Abduction and cross it over, which is adduction. Perfect. Now we're going to, so the hips and knees are all within full range of motion. We're going to move over here, and I'm going to have you sit down. Perfect. Now I'm going to have you do circles with just your ankles. So move your ankles around. Great. So she's plantar flexing, dorsiflexing, and inverting and everting her ankles. There's full range of motion in her ankles. Now I'm going to passively take her through range of motion. So we're going to start with the tibiotalar, which is dorsiflexion and plantar flexion. Again, on this side, let me adjust this just a little so you can see. Okay. On this side, I'm going to do the tibiotalar, so we're going to dorsiflex, plantar flex. And then the subtalar, so inverting and everting her ankle. Again, subtalar inverting and everting her ankle. And then the transverse tarsal, same thing, so I'm inverting and everting the end of her foot. Good, the passive range of motion is full. Now we're going to move on to the manual muscle strength. So raise your left knee up. There you go, don't let me push it down. Perfect, and the other one. Don't let me push it down. Great, and try to spread your legs apart. Push them back together. Good, and then with your leg apart from each other, try to kick in with your foot. Good, so that's the internal rotation again. Good, and now try to bring your foot out. Good, external rotation again. External rotation. Now kick me with your feet. Good, and then bring them back. Great, so that would be extension and flexion of the knees, and then push the top of your feet up into my hands, then push them down. Great, and your big toe, push them up. Good, so that was the flexion and extension of the ankles and the flexion of the greater toe. Now we're going to go back to the bed, and I'm going to have you lie on your stomach, okay? Okay, and lift your leg off the bed for me, and don't let me push it down. Great, and the other leg, lift it off the bed, don't let me push it down. Great, so this is checking extension of the hip, and you can come back over here and sit down.
Okay.
So the manual muscle strength of the lower extremities is 5/5, and again, the hips, knees, ankles, and feet were all within full range of motion. Now I'm going to check for clonus in the feet. So just go ahead and be nice and relaxed. Great. And this side. No clonus is noted here. And I'm going to move on to the reflexes, okay? I'm going to start with the triceps. Great. And the triceps. The biceps. So relax your arm. Good. And the biceps on this side, just relax it. Perfect. And the brachioradialis, so relax your arm. Good. And again, the brachioradialis, relax. Good. And then the patellar, relax your legs. And this one. And then the Achilles, so I'm holding her foot. Perfect. And this one again, Achilles. And then the plantar, I'm tracing the bottom of her foot. Great. And this one. Great. The DTRs are all 2+ and symmetrical, and the toes are facing downward. Now I'm going to move on to the last portion of the exam. I'm going to have you trace your heel all the way up to your knee and back down with your eyes closed. Great. And then the other one. Perfect. And then we're going to check the rapid hand movement. So you're going to go up, down as fast as you can. Great. And then tap your feet into my hands as fast as you can. Perfect. And then now I'm going to have you take your finger and go from your nose to my finger, okay? Here. Back to your nose, to my finger. Great. And then once you get back to your nose, close your eyes. Perfect. And then back to your nose. And then we're going, it's okay, switch hands. So you're going to do your left hand. Perfect. And then back to your nose. Now close your eyes to my finger and back. Great, very good. Now I'm going to go into the gait. So I'm going to have you stand up over here. Walk to the dresser and back. Great. And then walk back to the wall on your tippy toes. So I'm checking for muscle coordination here, gait, and then back on your heels. And I'm also checking for balance. And then walk back heel to toe. Perfect. Great. Okay, and then we're going to come back over here. We are going to do the Romberg test. So put your toes and your heels together. And you're going to close your eyes for 30 seconds, okay? I'm right here. Okay, and then with your eyes still closed, bring your hands out with your palms up straight in front of you. I'm checking for pronator's drift, which is not noted. And now we're going to move on to the vertebral part of the exam. So turn around for me. I'm starting by inspecting. I'm inspecting the cervical vertebrae, thoracic and lumbar vertebrae. I'm looking for any discoloration, any deformities, atrophy, swelling. None of these are noted, and the spine is symmetrical and aligned. The shoulders, scapula, and iliac height are also symmetrical. Now I'm going to palpate. I'm palpating the cervical vertebrae, the thoracic vertebrae, the lumbar vertebrae. There is no bogginess, heat, tenderness, or swelling over the bony prominences or the joints. Now I'm going to palpate the neck muscles and the paravertebral muscles. Is there any tenderness there?
No.
There is no tenderness, heat, swelling in these muscles here in her neck, and it is symmetrical. Now we're going to go through the range of motion of the cervical vertebrae. So look at the ceiling for me, and then down at the ground. Look to your right and to your left. Put your left ear to your left shoulder.
Oh.
And then your right ear to your right shoulder. The neck is within full range of motion, so the cervical vertebrae are within full range of motion. And now we're going to check the thoracic and lumbar vertebrae. Touch your toes. And then stand up and bend backwards for me. Great. And then back straight up. And then look to your right with your body, with your whole body. There you go. Great. And then to your left. That's better. Good. And then put your left arm down your left leg and your right arm down your right leg. Perfect. The thoracic and the lumbar vertebrae are within full range of motion there. And with this, I am done with my exam. Thank you.